5 health checkups you might want to skip after 70. They could do more harm than good. There's a hidden truth most seniors never hear from their doctors. Every year, millions of older adults line up for routine health tests thinking they're protecting themselves. But what if some of those tests, the ones you're told you need, could actually push you toward unnecessary treatments? Surgery, stroke, or even cancer. New research suggests that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. Even more surprising, nearly everyone over 70 may be getting over-tested without realizing it. One of the checkups on this list is linked to about 5% of cancer cases in the US, roughly the same risk associated with daily alcohol use. You probably won't see this on a billboard, and your clinic may never mention it. But today, we're bringing the science into the spotlight. In this video, we're breaking down 5 health checkups you may want to reconsider after 70, what they can do to your body, and why doctors are starting to rethink them. All backed by real research. And trust us, the one at number 2 might surprise you. Now, let's get started. Number 5, bone density scan. DEXA. It sounds harmless, quick, painless, and no needles. A bone density scan measures how strong your bones are and screens for osteoporosis. But after age 70, it often creates more worry than benefit. Research published in the Journal of the American Geriatric Society followed more than 200 women over 70 and found these medications lowered fracture risk by just 0.3% over 5 years. A very small benefit compared to the risks. Take Rose, a 76-year-old retired piano teacher. She had no falls, no pain, and stayed active. After a routine scan showed mild bone loss, she was started on medication. Within 3 months, she developed intense reflux and jaw pain. Once the medication was stopped, she focused on vitamin D, strength training, resistance exercises, and a calcium-rich diet. A year later, she was stronger, more balanced, and fracture-free. For many people over 70 who aren't experiencing falls, lifestyle changes, strength training, proper nutrition, balance work, and treating vitamin D deficiency can reduce fracture risk by over 20%. For many people over 70 who aren't experiencing falls, lifestyle changes, strength training, proper nutrition, balance work, and treating vitamin D deficiency can reduce fracture risk by over 20%, according to a 2202 Osteoporosis International study. Don't let a number on a screen scare you into treatment. Number 4, brain MRI for mild memory loss. When forgetfulness creeps in, fear often follows. Fear of dementia or Alzheimer's. Doctors frequently order brain MRIs, hoping to find answers. But here's the uncomfortable truth. Most MRIs in people over 70 simply show normal age-related changes. A 2021 review in Neurology Today examined over 3,000 MRIs from adults ages 70 to 85, with mild cognitive concerns. While 86% showed some type of abnormality, only 3% were linked to treatable conditions. That means 97% of patients endured the emotional stress of being told, "Something is wrong," when it often wasn't. Nearly 12% were sent for invasive procedures like spinal taps. Number 3, cardiac stress test. This test monitors your heart during exercise to detect blocked arteries. It's commonly ordered for mild fatigue or vague chest discomfort. But in adults over 70 without clear heart disease symptoms, it can trigger dangerous false alarms. Studies show false positive rates can reach 40%, often leading to angiograms, stents, or bypass surgeries that may provide no real benefit. A major 2017 study in JAMA Cardiology found more than half of stents placed after stress test referrals went into patients who had no meaningful symptoms, and their survival or quality of life didn't improve. Raymond, a 75-year-old retired mail carrier, mentioned mild fatigue on hills during a checkup. After an unclear stress test, he underwent catheterization and received a stent. That night, a reaction to the contrast dye caused kidney complications and a 6-day hospital stay. Number 2, colonoscopy. This one surprises many people. Colonoscopy is valuable earlier in life, but after 70, and especially after 75, the risks climb significantly unless symptoms are present. Preparation alone can cause dehydration and kidney issues. Sedation carries cognitive risks, and complications such as bleeding or bowel perforation become more likely with age. A 2019 study in JAMA Internal Medicine, tracking 1.3 million Medicare patients, found that among adults over 75, only 2 lives were saved per 1,000 colonoscopies, while more than 20 people experienced serious complications. Dana, a 73-year-old grandmother with no symptoms and 2 previous clear screenings, agreed to another colonoscopy at her doctor's urging. After a small polyp was removed, she suffered a bowel perforation and spent 9 days recovering. The U.S. Preventive Services Task Force recommends stopping routine screening at 75 for most adults. For healthier seniors, non-invasive stool tests like the FIT test often provide a safer alternative. Once you enter the colonoscopy pipeline, it can be hard to step off. So ask about your options. And now, the most overused and potentially harmful Number 1. Annual full-body CT scans marketed as cutting-edge prevention. Full-body CT scans promise early cancer detection, but they also expose your body to high levels of radiation, about the equivalent of 500 chest X-rays per scan. A 2023 modeling study in JAMA Internal Medicine suggests CT scan use may account for up to 5% of cancers in the U.S. Even more concerning, there's no solid evidence that full-body scans save lives in people without symptoms. These scans often find harmless nodules or cysts that trigger a cascade of follow-ups, biopsies, and fear. Marcus, an active 80-year-old martial arts instructor, underwent a private executive screening. A tiny nodule led to oncology referrals, a PET scan, and a needle biopsy, which collapsed part of his lung. The nodule turned out to be benign. Experts, including the American College of Radiology, strongly advise against full-body CT scans for routine screening in symptom-free adults. If you have concerning symptoms, unexplained weight loss, coughing up blood, unusual swelling, targeted imaging is appropriate, but scanning everything just in case can create more danger than protection. Modern medicine is powerful, but more testing isn't always better. Sometimes, less truly is more. Always ask your doctor, what happens if this test finds something? Will it change my treatment? Do the benefits outweigh the risks? Real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your screenings wisely. Now we want to hear from you. Have you or someone you love ever dealt with complications from a medical test that turned out to be unnecessary? Share your experience in the comments below. Thanks for watching.